Yeah, superb performance. Put us in a fantastic mood, so thank you so much for that. Right now, though, we're going to continue a vitally important discussion, not just because World Cancer Day is coming up on Thursday, but because we need to be spreading awareness around this every single day of the year. And we are very lucky to have Specialist Surgeon Dr. Justus Apfelstadt in studio with us, dancing a moment ago, but we're going to let him do what he does best, and that's answer your questions today relating to cancer as it relates to the coronavirus, because obviously the pandemic has put added pressure on our medical system in a way that we've never experienced before, but it's also changed our mindset. And I think a lot of people, as you mentioned, are too scared, if you find a lump, too scared to go into hospital because you are worried about contracting the virus. So we want to dispel that. That is not the case, but I really am interested to find out what sort of an impact the coronavirus and the stress, the pressure that that's put on the medical system is having on the treatment of cancer. You've touched on it, but maybe you can elaborate a bit more.
Yes. I've alluded to the worsening of prognosis by people not coming to a hospital, then the scarce health resources that we have preventing us from doing necessary things, but on the converse side, that most of cancer treatments are not impacted by COVID. However, there's also a beneficial effect of COVID-19 because we now see people have a move towards living healthier, and that is, I think, what in the long term will be a positive effect. The other thing that strikes me about COVID is resource allocation. And that's always critical in a country with limited resources. And sometimes it may be hard to say, yes, we are not going to take care of all COVID-19 patients because we also have the cancer patients to look after. Because if you're diagnosed with cancer, in contrast with COVID, where it's painfully clear, within 4 weeks you will know that the patient survives or dies. And this is now something that's very hard. And this is something that goes to my heart, especially in breast cancer, but also for any other cancer. The cancer victim does not die in a hospital and in public 4 weeks later or before that even. It takes a year, 2 years, 3 years, 5 years,
battle, yeah.
And then it happens at home, and it doesn't come into the statistics easily. And that is the tragedy about it. Once again, delaying the diagnosis will have a much bigger, by orders of magnitude, effect on your chance of long-term survival than a COVID-19
Than if you contract the virus.
And the risk of a COVID-19 infection in a care environment is actually low.
And what do you have to say to those people that fear contracting COVID-19 and so they delay again the process of early detection and going for the diagnosis because they do not want to come into contact, so they'd rather stay at home as opposed to actually get tested and go out there?
You know, we spoke earlier about the motto of the World Cancer Day. It is, I am and I will. Take action in your neighborhood. Take these women, take these men, take them out of their home environment and explain to them it is much worse sitting at home. So here's something that you can do in your neighborhood. And where at all possible, take them to a place where to a diagnostic place that is in a hospital, a specialized clinic, or there are also here in the Western Cape, there are specialized clinics outside of hospitals that can diagnose, where you will see only specific people of that cancer and no COVID-19.
I mean, our hospitals, our medical staff have had 9 months to get to grips with how to deal with this pandemic, and they are doing it. They are doing it brilliantly, so don't let that fear stand in your way. We've got Ilse now joining us on the line from Port Elizabeth. Ilse, a very good morning from the team here in studio. What is your comment or your question for the doctor?
Good morning to the Expresso team, and good morning to doctor as well. My problem started about a year ago, just before when the lockdown kicked in. I'm having a lump here in my lower abdomen. So when I went to the clinic, they said it could be gynecological, it's a gynecological problem. But then I went for a colposcopy after that, where they removed a precancerous cell, and then also the last gynecological exam was clear. They said the lump has nothing to do with that. It might be my colon. So I was just wondering, should I do further investigation or should I just leave it? Because there is quite a few other symptoms like weight loss and a few other symptoms that relate to that. So I don't know if I should go for further testing and if it could be cancer or should I just leave it?
Obviously, you should go for further testing. A lump that has arisen that you suddenly become aware of should be diagnosed until there is a good diagnosis
A
on it.
definitive answer.
Yeah.
Okay, so the short answer is yes, go and get further testing. Whatever you need to do that. Don't take any chances in this case. Elsa, I hope that helps.
And
Okay,
if,
thank you.
and if need be, go for a second opinion on it.
Okay.
It's also very important.
With regards to treatment also now in this space, what can patients ensure to make sure that they're still getting the treatment during COVID-19?
I think the treatment organizations in this country are well suited and well willing to continue with treatment. We've seen that in the public sector. We doctors have been available and willing to treat people. In the private sector, things continue virtually as normal. Obviously, we make certain adaptations. For example, when we couldn't operate, we tided people over with systemic treatments, as we call them, like hormonal treatment or biologicals, and a combination of that with chemotherapy to come into a calmer time. So there are ways and means of dealing with it. But the patient must come to us, please.
I'm just going to reiterate, and we're going to pick up the conversation again in a moment with the doctor, but I, during the first peak, had to spend some time in hospital, and I can tell you I didn't feel any risk whatsoever. Our hospitals are prepared and ready for what needs to happen, so don't let that stand in the way of you getting a diagnosis. If you have found a lump, if anything is concerning you, not just around World Cancer Day, but any day, make sure that you seek the right kind of help. It's all about early detection. We're going to continue the conversation in a moment.